Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're exploring another potent nasal spray for environmental allergies, Ryaltris. Ryaltris is a prescription combination spray containing two well-established allergy medications, Olopatadine and Mometasone. So it offers a dual mechanism approach targeting both rapid histamine-driven symptoms and the underlying inflammation right at the nasal mucosa. In a previous episode, I covered Dymista, another antihistamine corticosteroid combination spray. If you have not watched that video yet, the link is above. But today, our focus is Ryaltris, a newer FDA-approved combination nasal spray in the physician's toolbox to treat allergy nose, also known as allergic rhinitis. In the clinical studies, Ryaltris showed a quick onset of nasal symptom relief within about 15 minutes. Furthermore, similar to Dymista, Ryaltris also demonstrated significant improvement in the eye symptoms. So these combination nasal sprays may help not only allergy nose, but also allergy eyes, or what we call allergic conjunctivitis. You might recognize one of the ingredients in Ryaltris from products you can buy over the counter. For example, Nasonex contains mometasone, but the amount of mometasone per spray and the dosing schedule can differ between products and formulations. In Ryaltris, each spray delivers 665 micrograms of olopatadine and 25 micrograms of mometasone, while Nasonex contains 50 micrograms of mometasone per spray. The dosing directions are also different. For adults and adolescents 12 years and older, Ryaltris is given as 2 sprays in each nostril twice a day, whereas Nasonex for the same age group is typically given as 2 sprays in each nostril once a day. So, what should you know about Ryaltris? In this episode, we will walk through 5 key things: its indication, how it works, how to use it correctly, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Ryaltris and who it's for? Ryaltris is a fixed-dose combination nasal spray that contains olopatadine, an antihistamine, and mometasone, a corticosteroid. It was approved by the FDA in January 2022 for the treatment of seasonal allergic rhinitis symptoms in adults and adolescents 12 years and older. For patients who have tried oral antihistamines or single-agent nasal sprays but do not feel well controlled, Ryaltris can be a strong option to help manage these more refractory allergy symptoms. Before starting Ryaltris, it is important to discuss with a healthcare provider whether Ryaltris is appropriate and how it fits into the overall allergy management plan, including whether additional oral medications or other nasal sprays are still needed. Second, how does Ryaltris work? Ryaltris combines olopatadine and mometasone, which act on different parts of the allergic response. Olopatadine is an antihistamine. It blocks histamine, the chemical that drives itching, sneezing, and mucus production during an allergic reaction. You may already know antihistamines like Benadryl, Claritin, Zyrtec, Xyzal, or Allegra. In Ryaltris, olopatadine is delivered directly to the nose, where allergy symptoms start, rather than being taken by mouth. In contrast, mometasone is a corticosteroid with broad anti-inflammatory effects. It helps reduce the activity of multiple immune cells and mediators in the nose, decreasing allergic inflammation and improving nasal symptoms. By putting these 2 medicines together in a single spray, Ryaltris offers both faster symptom relief and ongoing inflammation control. making it especially helpful for patients with moderate to severe allergic rhinitis who are not adequately controlled with single ingredient over-the-counter products. Third, let's talk about how to take Ryaltris. Ryaltris is for use in the nose only. For patients 12 years and older, the recommended dose is 2 sprays in each nostril twice a day. Each spray delivers 665 micrograms of olopatadine and 25 micrograms of mometasone. Good technique is key to making sure the medicine reaches the nasal tissue and to help reduce side effects. Before the first use, Ryaltris needs to be primed by releasing 6 sprays or until a fine mist appears. If the spray has not been used for 14 days or more, reprime it with 2 sprays or until a fine mist appears. Both the package insert and the official website provide full step-by-step instructions, so make sure to read them carefully. But here are several important points. Before each dose, gently blow your nose to clear the nostrils, and always shake the bottle for at least 10 seconds, because Ryaltris is a suspension and needs to be well mixed. Keep your head slightly tilted forward, not backward, to reduce the amount of medicine that goes into the throat. If some medications does reach the throat and causes an unpleasant taste, that is expected and normal. Try not to blow your nose for at least 15 minutes after using Ryaltris to make sure you receive all the medicine. Ryaltris should not be sprayed into the eyes or mouth. Avoid aiming the spray directly at the nasal septum, the central wall between the nostrils, because this area has abundant blood vessels and less nasal tissue, and spraying directly on it may increase the risk of nosebleeds without improving symptoms. After the initial priming, each Ryaltris bottle provides 240 meter sprays. The bottle should be discarded after 240 sprays, even if medicine remains, because accurate dosing can no longer be ensured. Finally, avoid using Ryaltris together with strong CYP3A4 inhibitors, such as certain antifungal drugs or HIV medications, because they can increase systemic exposure to mometasone. Review all prescription medications, over-the-counter products, and supplements with a healthcare provider to check for possible interactions. Fourth, let's review the warnings and precautions for Ryaltris. Even though Ryaltris is designed to act mainly in the nose, it still contains both an antihistamine and a corticosteroid, so systemic effects may occur. First, Ryaltris may cause drowsiness mainly from the olopatadine component. In clinical trials, only a few patients reported feeling sleepy. However, you should still avoid driving, operating machinery, or doing anything that requires you to be full alert until you know how Ryaltris affects you. Alcohol and other medicines that affect the central nervous system may increase drowsiness and impair performance, and should not be used together with Ryaltris. Second, local nasal effects may occur. This can include crossing in the nose, nosebleeds, runny nose, nasal ulcers, or rarely nasal septal perforation, a hole in the cartilage between the nostrils. These risks are known with intranasal sprays approved to treat allergic rhinitis. Because steroids can slow wound healing, patients who have had recent nasal ulcers, nasal surgery, or nasal trauma should avoid using Ryaltris until healing has occurred. Localized fungal infections with Candida in the nose and throat have been reported with mometasone nasal products. Let your healthcare provider know if you notice redness or wet patches in the nose or mouth. If thrush or other Candida infection develops, your doctor may prescribe antifungal treatment and consider stopping Ryaltris. People using Ryaltris for several months or longer should have their nasal mucosa checked periodically. Third, because Ryaltris contains a corticosteroid, it may affect how the immune system responds to the infection and may increase the infection risk. While using Ryaltris, patients should avoid contact with people who have contagious illnesses such as chickenpox or measles. The prescribing information highlights conditions such as tuberculosis, chickenpox and shingles, measles, untreated local or systemic fungal or bacterial infections, systemic viral or parasitic infections, and ocular herpes, where Ryaltris use may worsen the infections. If you have or have had any of these conditions, or have relevant travel or exposure history, Ryaltris should be used with caution and discussed with your doctor. Fourth, when Ryaltris is used at higher than indicated doses, or in patients who are more susceptible, steroid-related systemic effects such as hypercorticism and adrenal suppression may occur. Using Ryaltris together with other inhaled corticosteroids may further increase this risk. If signs of excess steroid or possible adrenal suppression appear, inform your doctor for further evaluation and management. Nasal and inhaled corticosteroid may also contribute to the development or worsening of glaucoma and cataracts. Anyone who notices change in vision or who has a history of elevated eye pressure, glaucoma, or cataracts should have regular eye exams while using Ryaltris and report new visual symptoms promptly to an eye care professional. Lastly, as with other corticosteroids, Ryaltris may slow growth in pediatric patients. Adolescents using Ryaltris should have their growth monitored routinely, and the lowest effective dose should be used whenever possible. And finally, let's talk about the side effects and safety of Ryaltris. In pivotal trials involving patients 12 years and older, the most common side effects were altered taste, nosebleeds, and nasal discomfort. Apart from altered taste, the rates of these side effects were generally comparable to what was seen with the individual ingredients and with placebo. In a long-term safety study of up to 12 months, no new safety signals were identified. Hypersensitivity reactions may occur with Ryaltris, as allergic reactions, including wheezing, have been reported with intranasal mometasone. Stop using Ryaltris and seek immediate medical care if you develop signs of a serious allergic reaction, such as wheezing or trouble breathing, hives or rash, or swelling of the face, mouth, or tongue. Overall, Ryaltris has a well-characterized and consistent safety profile when used as directed, with its benefits supported by clinical trials showing improvements in nasal symptoms and quality of life measures. And there you have it, 5 essential things you need to know about Ryaltris. For patients with allergic rhinitis who continue to experience runny nose, itchy nose, congestion, and sneezing, despite over-the-counter or single-agent therapy, Ryaltris offers a targeted combination treatment option backed by compelling clinical data. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.